Okay, well, good morning, and thank you for joining us this morning. I'm gonna try and make this short and sweet today. I'm not planning on this being something that's going to be super in depth, but what we hope to accomplish today is to talk about what are the things that we can individually do to help bring an end to all of this, madness that's been going on in the world, and especially here locally for us with regards to the COVID-19 pandemic. It's been kind of a crazy 5 months, something I don't think none of us have ever experienced anything like this before. Shutting down businesses, layoffs, the unemployment. It's been a really difficult time, and it's been harder, for some, and we want to make sure that we can do what we can to help speed return to not having to deal with a lot of these restrictions, and to get employment back, and get people back to work, and to avoid a repeat of what we've already seen earlier this year when the COVID when this pandemic first broke out, and back in February and March, when we were really becoming aware of it, and it started to really impact us here in the United States. We weren't really sure what we were dealing with here. And there's still a lot of unanswered questions with regards to this virus and the disease that it causes. The virus is the SARS acute respiratory syndrome coronavirus 2. And so, lots of times we talk about the virus, and sometimes, we're talking about the disease. COVID-19 is the disease that is caused by the SARS-CoV-2 virus. These SARS viruses, we've seen several mutations of this virus over the years. And I think one of the things that's kind of scary here is that, we've seen past SARS outbreaks, and this is just another iteration, of that. What's the likelihood that we'll see another one in the future? Well, I think it's guaranteed that we'll see additional mutations of this virus in the future. At some point, will we run into one that is as contagious as the SARS-CoV-2? Probably, and maybe even one that is a lot worse, one that is much more deadly perhaps. And that would obviously be something that we really want to be able to understand and be able to prevent. And so I've heard a lot of people talk about this as kind of a dry run for us. This is kind of a practice for, a really bad pandemic. And that's not to say that this isn't a bad pandemic. I mean, worldwide, deaths that are attributable to the COVID-19 are approaching 1 million. I mean, it's getting up there. And even here in the United States, we've topped 150,000 deaths that are attributed to the COVID-19 disease. But that's not to minimize that, but it could be a lot worse than this. And so understanding how to react in these kind of situations, I think, is very important. What's unique about the SARS-CoV-2 virus? Well, it's extremely contagious. You're much more likely to catch this virus than other things like the flu, for example. And we've heard a lot of talk about people saying, well, it's really just like the flu. It's no big deal. It's no worse than the flu. And I think it is, worse than the flu in a lot of different ways. Unfortunately, this topic has been politicized. And even to the point where some places people will look at you and go, if you're wearing a mask, you must be a liberal, or I'm not wearing a mask because I think this is all made up, and I think this is some sort of political conspiracy. And I'm not here to debate those arguments. I'm here to tell you and ask you to try to do your part to help us avoid having to return to the types of shutdowns that we saw back in March and April. We don't want to repeat that. And the best way to avoid repeating that, and for us to be able to progress out of our current status and get to a green status, is by lowering the case counts, the daily case counts. If we can get that low and keep it low, not only is this more likely to pass, but we're also much more likely to avoid additional impacts on the economy and get the economy going a lot faster. This particular disease, COVID-19, has a death rate of pretty, we talk about a wide range here, 0.3% up to about 5.7% of people who get COVID-19 will die. And so that seems like kind of a wide range, and it really depends on the conditions in the area where the outbreak is happening. It could be, factors that have to do with the population. It could be environmental factors. In fact, it was interesting to see that one of the things they say increases your chance of this affecting you more is if you live in an area with higher pollution. Some of the underlying health conditions that can result in COVID-19 being more serious or maybe even fatal may be diseases that are specific to certain ethnic backgrounds, like sickle cell disease is one that the COVID virus, may affect even more of those people who have sickle cell disease. So this is a disease that has a pretty moderate death rate. Here in Utah, I think our current death rate is around 0.7%. How many deaths we've had attributed to COVID-19 versus the total number of cases. Nationwide, currently, we're looking at about 3.3%. And I think worldwide, if you look at the most recent numbers that are on the Johns Hopkins website that is popular, puts us at about 3.7%, with the fatality rate worldwide right now on average. So, but that's not a good thing to say that out of 100 people who get this, 3 of them are going to die. Normal fatality rates for influenza, for the normal flu, is about 0.1%. And so the fatality rates are much higher for COVID-19 than they are for the flu. And, the contagiousness of this virus is much greater as well. It's really easy to pass it from person to person. It can cause, in addition to death, it can also cause permanent damage in a lot of cases to people's lungs, their liver, their heart, their circulatory system. It can result in a permanent loss of your taste. I mean, I like food. I want to be able to taste my food. It can result in blood clots and even stroke that can have permanent effects or even death as well. And so it is something to take seriously. I think a lot of people say, well, especially young people don't think anything serious is going to happen to them. But often we do see young people who die or even suffer some sort of really severe reaction or permanent health conditions, or potentially permanent health conditions arising from contraction of this virus and COVID-19. Who are individuals that are particularly at risk? And so I cover these again just to make sure we understand we need to try and protect these individuals. And if we fall into these categories, we need to make sure we're being extra careful ourselves. Extremely elderly people, if we get up to folks in their 80s who contract this virus and get sick, I think some of the numbers I looked at recently were about 50% mortality for that folks. So you go from 1 or 2% for mortality rate. If you're elderly, it could be up to 50% mortality rate. And so obviously that's something we want to avoid. So underlying health conditions, regardless of age, can result in permanent damage or death. So lung, kidney, liver, heart problems, if you have any diseases associated with those, could be very dangerous. Respiratory conditions like asthma, diabetes, and high blood pressure are also conditions that put you at greater risk. Cancer, sickle cell disease, or any other disease or medications that you're taking that inhibit or reduce your immune system. And if your immune system is compromised for whatever reason, whether it's a disease or medication or whatever, that puts you at higher risk. And then an interesting one that I found was this areas of high air pollution also put people at higher risks, because often people who are subjected to bad air quality on a regular basis for long periods of time kind of do develop respiratory conditions that put them at greater risk, and they may not even be aware of it. So how is this transmitted? It's transmitted, and you've all heard the term before, through respiratory droplets. we can be infected directly or indirectly. So directly, being having this transmitted to you would look like someone's talking to you and some droplets that spew from their mouth because they're spraying it when they say it, comes into contact with your eyes, into your nose or your mouth, you inhale it. And that's, direct transmission. But there is also indirect transmission, where a surface becomes contaminated, or maybe a hand becomes contaminated. And so you sneeze on your hand and you shake somebody's hand, and then they, rub their eye, with that hand. So that, or a device, like, a faucet handle, a doorknob, or a cell phone that has been handed from one person to the next, or has otherwise been in contact with a surface, that was contaminated, and then you touch that and you then have that on your hand. And again, it has to come up here to your face. So, your eyes, your nose, your mouth, the mucous membranes are where that virus can pass through into your system. And so when we're talking about, how it's transmitted, it's either going to be something you directly inhale because it's in the air from somebody who's been, ejecting these droplets fairly recently, or you're coming into contact with a surface where those droplets have fallen and come to rest there. So, it can float around in the air for minutes, maybe even up to hours, depending on the conditions. But it's not an airborne virus, at least not that it's been determined up to this point. So when it's spewed into the air, eventually it's going to fall down and rest onto a surface is where it's headed. Once it's on a surface, that virus can still be able to infect people for hours or even up to days, depending on the conditions. Again, humidity, heat, exposure to sunlight, the type of the surface, whether it's glass or metal or wood or some other natural fiber or synthetic fiber, is going to, affect how long that virus is able to be viable on that surface. So we really need to be careful, especially where we're talking about surfaces, because it could be a day. And usually by the time the virus is on a surface, it's got about a day before it's going to lose its ability to infect you. But there are certain surfaces and certain conditions where that virus has been found to still be surviving up to a week after it was on that surface. So we really need to be careful with that indirect contact as well. Once someone comes into contact with the virus, the incubation period can be up to about 15 days. On average, people will become symptomatic within about 3 to 5 days, but it can be as much as 15 days before we start to see those symptoms. And that the virus is most contagious about a day before the onset of symptoms, and then into the first few days after the onset of symptoms. And so a lot of people are out there and they're not symptomatic yet, or maybe they're, and there's also those who never become symptomatic, but they've picked up the virus and it's multiplied in their system. And so, even that day before, you don't even know you're sick yet, you're going around and you could be spreading this virus and you have no idea that it's happening. But that's when, it's most contagious, is that day before to a couple days after, you start to have symptoms. So how do we control this virus? How do we bring this madness to an end? Well, one way, eventually, we achieve herd immunity. In other words, enough of the population has contracted the virus and developed antibodies to it and immunity to it, that those individuals who are immune create a natural barrier for spreading the virus to others. And so once we achieve herd immunity, then the pandemic comes to an end because it can't spread through the population with the immune amount of immunity that exists in the population. Another way to achieve herd immunity, though, is through a vaccine. And of course, that's something we have high hopes for. That an effective vaccine will be released, and especially if we can get those at most risk vaccinated, we can really start to transition back to more normal kind of life. But things will probably never be the same after this, because this could happen again, and we need to keep this in mind and be prepared for it to happen again. The other thing that we can do to control it, because we don't really have a whole lot of control over, personally over the herd immunity or the development of a vaccine. The thing that we have the greatest amount of control over is what we personally can do to prevent either catching the virus ourselves or spreading it onto others. And so, I want to talk about prevention. Don't catch it, don't spread it. And the big thing is for yourself to not catch it, you need to remember your eyes, your nose, your mouth. If you're not inhaling respiratory droplets from another person, and you're not touching your eyes, your nose, and your mouth, with infected hands, then you're going to be able to most likely avoid getting this disease. And so that's one thing to remember, the face, not touching the face, washing or sanitizing your hands frequently, but washing is better, especially washing your hands and lathering them for 20 seconds. The longer you lather, your hands when you're washing them, the more that virus you kill. And so good hand washing, but you can also use hand sanitizers. Those are good as well, but don't just totally rely on hand sanitizers because they don't remove the soil, from your hands. And so after a while, you get a lot of that soil built up, and it can be more difficult to sanitize or to disinfect what's in there. Disinfect common surfaces is another thing that we can do. Those doorknobs and railings and high touch surfaces, making sure that we have a practice of going through on a daily or even more frequent basis and disinfecting those surfaces, and maybe even disinfecting them as you go. If you touch a surface, make sure and sanitize it, after you touch it. And then distancing, staying away from other folks. If we can maintain that 6-foot distance, that virus generally can't spread more than that several feet away from the person when it comes out in those respiratory droplets. It's not a guarantee, depending on conditions, it could travel farther than that, but that's how we can basically protect ourselves. Does a mask help? And the most direct answer to this is yes, it does. There's been many studies. In fact, there was an article that came out recently. Some of you may have seen it. Several scientists at BYU compiled data from 100 different sources almost. It was like 98 or 99 different sources they had of studies and field experience where they collected data and they compiled that. And basically, they determined that absolutely masks are effective. Now, does it mean that it's 100% effective? No, they're not 100% effective. In some studies, the mask was able to filter out about 90% of influenza virus. And in some of those studies, they actually found that in their study anyway, 100% of the COVID virus or the coronavirus was filtered through the masks that they were using in studying. The important thing to understand about a mask is it's not about personal protective equipment, okay? And we think about it that way. I'll wear a mask so I don't get sick. But the real reason, and the most important reason we wear a mask, is because we don't want to spread to others. And that's why we need high buy-in from people. We need everybody, or a very high percentage of the population to be wearing a mask when they're around others, when they're out in public. That's source control. Because the mask is quite effective at catching those respiratory droplets and holding that virus in the mask instead of it getting out and floating in the air and resting on surfaces, we are able to reduce the amount of virus that's out where we can come into contact with it to a point where, it doesn't become a problem anymore. Countries that have a social norm of wearing masks, where it isn't a different thing for them to do like it was for us here, their initial infection rates were about 56% lower than what we experienced here in the United States and other countries where wearing a mask is not a social norm. So, definitely the evidence is there that where people wear masks and it's more of a common thing, it does not spread as fast. Also, it can help reduce the viral loading. How much of the virus is out there in the air, when someone's, exhaling or talking or sneezing or whatever, or how much of it's on the surfaces around us. So if we can reduce the viral load, if we're exposed to less virus, some studies have actually showed that how sick people may get because of infection is going to be less severe if they're exposed to less quantity of the virus in the first place. So wearing a mask, actually in a couple of very key studies, demonstrated that 75 to 82% lower infection rates happened where masking was, near universal in the population. So again, it doesn't mean nobody's going to catch the virus, but the vast majority will not. And so, what has been determined by many is that if we can get to a point where we have 80% of our population wearing a mask, this pandemic level, and we can prevent a total shutdown of our economy again. And so there's still going to be some people who don't mask up, but if we can get to that 80% mark and sustain that for a few weeks, we should be able to see an end of this virus, at least it being something that's going to threaten our economy and threaten additional shutdowns. But it has to be done everywhere. If one area, one city, people mask up and they get their rate down, but the surrounding, communities don't do that, then, it's still going to travel around. And so it's something we really need to try and do together. So I want you to kind of recognize one of the big takeaways from today I want you to think about is spread versus contraction. You don't want to catch the virus yourself. You don't want to contract the virus. But the most important thing for us to protect our communities, our economies, is to prevent the spread of the virus. So my mask protects you, your mask protects me. Don't think of your mask as being something that is protecting you and filtering everything out, because there's, especially just the face coverings, there's air that's coming in around the sides. It's not 100% effective, as far as protection. It is effective. It does provide some protection, but where it really provides protection is to the community as a whole, in catching those droplets and not spreading, that virus out there. And also, if you're sick, stay home. More so than ever, we don't want to go to work sick and risk spreading, this virus. Even if we don't think that this is the coronavirus that we've caught, if you're sick, stay home. And here's an example. You can see this. They did this experiment where people were just speaking, and they illuminated the particles that were being ejected from people's mouths as they speak. And so you can see in these two representations here, without a mask, it looks like looking into a starry night here with all these particles illuminated with lasers. But and in the other picture with someone wearing a mask while they're talking, there are still a few particles, that escape out around the sides of the mask, or maybe the mask isn't being worn completely correctly, but it's going to reduce the vast majority of all those particles coming out of someone's mouth. And that it provides that protection against spreading that virus around. Distancing is very important as well, staying out of that distance. But in addition to that, we still need to think about the indirect contact, coming into contact with surfaces after somebody else has been in that area. So other things we need to do to prevent us catching the virus, and we don't spread the virus unless we catch the virus, is distancing, that 6-foot rule, washing your hands frequently and washing them long enough with soap and water or with a hand sanitizer, and really avoid touching your face. And I know sometimes it's almost impossible. I get this itch, I have to touch it, right? Go sanitize your hands real quick first, or go wash your hands, first before you, rub your eye or scratch your nose. If you can help try and develop that habit of not putting your hand to your face, at least not until you have, washed and disinfected your hand immediately before doing it. That's going to be really important. And then the mask, obviously, if it's doing its job and catching particles and maybe catching some virus in there, we need to make sure and wash that mask out, daily. We should wash it, not just rinse it, but we should wash it with soap at least once a day, so that we're not touching the mask, getting virus that the mask has collected, and then still, transmitting that to our eyes, nose, or mouth. So in summary, if we want to have the economy stay open and continue opening and get, through this economic recovery, we need to have fewer and fewer cases. If we're having increasing cases, Governor Herbert told us just a couple of weeks ago, that if we didn't get our average case count of 500, that he was going to look at the official averages. I went back and kind of added up the last 7 and 10 days, and it looks to me like we have achieved that under 500, average new case count for the last 7 and 10 days now, but it needs to keep going down. So protect yourself by washing your hands frequently. Don't touch your face, especially be careful to protect your eyes, nose, and mouth, and keep that distance of 6 feet from other people, especially if they're not masked up. You protect others by wearing a mask, and it needs to cover your mouth and your nose. I see people walking around with it just covering their mouth. You still have respiratory particles, that can exit through your nose. Obviously, you're going to eject a lot more while you're speaking. That's going to be the much higher risk when people are speaking, but just breathing, can do it as well. So cover the mouth and nose, and again, distance to protect others as well. So do we have any questions?
Folks, if you got any questions, please type those into the chat box, and we'll have Doug answer those right now. Interesting subject. It's been a challenge to all of us, and we hope everybody out there has avoided this or has gotten through it well. We've had some of our members have some employees contract the coronavirus, and it's been a challenge to them dealing with that, and it's definitely been a challenge to all of us. So go ahead and type your questions in the chat box. Mayor Wynn, thank you. Mayor Wynn says, thank you, Doug. Great information. And with that, we're live on YouTube, so I think we're gonna wrap up if there are no other questions. Thank you very much for attending today. Doug will be doing this same presentation at 9 o'clock today for those that don't get up early in the morning. And at 10 o'clock, I'll be talking about donated properties and how we can avoid any pitfalls that might come along with that. So if you haven't signed up for either of those, and you've got some people that want to watch those, you can go to our website, utahtrust.gov, and click on training and events and sign up there, or you can send me an email to jason@utahtrust.gov, and I will send you a link to that as well. Doug, final word.
Let's just stay safe. Let's help each other stay safe, and let's get past this. And so a little bit of cooperation, regardless of how you view the current environment, from whatever your perspective is. If we can just do some simple things, mask up, contain, do that source containment, we can go a long ways to getting this in the rearview mirror sooner than later.
Great, thanks, Doug. Good information, we appreciate that. Everybody, go out and have a safe day.